It's one of the appointments you should always try to keep. We're talking about your eyes. Dr. Mansoor Mughal is a neuro-ophthalmologist and retina specialist with Retina Associates, PA, and today we're talking about the importance of screening. So, welcome back to the show. Good to see you again.
Good to see you again. Thanks so much.
Of course, why is screening so important though, and what exactly are you looking for in those screenings?
Absolutely. So screening is critical. It's vital to retinal health, and there's a number of conditions that generally we see, like diabetes, like macular degeneration. Sometimes patients are put on drugs for cancer, for rheumatoid arthritis, and it has diverse effects within the eye, and especially the retina. And so it's vital when patients have these disease diagnoses that they also see a retina specialist, so we can check the retina and make sure that everything is normal.
What type of treatments then do you use, or techniques I should say?
Techniques, so we have a number of techniques. Obviously when the patient presents, we take a good history, we find out when the particular medication was started, and sometimes that stratifies the risk that they have. And then we proceed to investigations, some simple color photography. We can also use some special photography which looks at the pigment within the retina, and sometimes that can be diseased. We can also take some high definition pictures of the retina itself with OCT. And then there's special dye tests that we can inject, small dye which we inject into the back of the hand, and then we take photographs as that dye circulates throughout the retinal circulation to see if there's any damage.
That's so interesting. So yeah, can you kind of walk us through the process though of if someone is coming in for this?
Oh, absolutely. So if somebody comes in, for example, for diabetic screening, it's relatively straightforward. We want to know, how long they've been diabetic, what their control is like, their blood sugar control is like, whether they have a relationship with their primary care provider or an endocrinologist, and then we check their eyes. Other than physically examining their eyes, we also check with an OCT machine just to make sure that they don't have any fluid at the back of the eye. And then with photographs, we can grade their degree of what we call retinopathy or retinal disease, and we can let them know what their risk is of developing complications. So it's very, very important.
I didn't realize how involved and complex this can be.
Absolutely.
Even just from taking a medication, depending on what you're taking, obviously. Yeah. Can you touch on some of the treatments offered?
Oh, well, absolutely. So for example, for diabetes, the kind of treatments, the more modern treatments that we offer nowadays, and although it sounds scary, is very effective, is intravitreal injections. So that's injections within the eye itself, which obviously patients are very apprehensive about, but they bring about wonderful results for patients' visual rehabilitation. The older treatments are still offered, including laser therapy, and that's just for diabetes. For macular degeneration, it's roughly similar. Their injections are the mainstay of our treatment, especially if it's a particular form of macular degeneration called wet macular degeneration. The dry form we still treat with we recommend vitamins to patients, absolutely. And then there are other conditions, for example, rheumatoid arthritis. If patients are started on a particular medication, for example, Plaquenil, often that, we need to screen for that. That can cause some effects on the central vision, but usually not until 5 years after they've been taking it. However, most people need a good baseline exam to exclude any progression of their disease.
Wow. Okay. So if someone is looking to get in touch though, and they want to maybe get that all checked out,
absolutely, how
can they get in touch?
So they can get in touch with us through the office and our office number, which is available, and also our website. And also they can, and most eye care providers, optometrists and our ophthalmology colleagues can refer direct to us.
Wonderful. Well, thank you so much helping us all see better out there.
You're great. Thank you so much.
Of course. And if you'd like to see this segment again, just head to our website at firstcoastliving.net.